1.
Hi, I'm Madison, and this is my doctor.
Miss
lab
Megan.
tech, Sarah Carter.
Yeah. And she's going to explain to us about blood and everything. So, yeah.
So I work here in the laboratory in the hospital, and we draw and process blood to help doctors diagnose their patients so that they're not just guessing what's wrong with you. They actually have some numbers and results to help diagnose you and treat you properly. Okay, so go ahead and set your arm up here. So the first thing we do when we draw blood is we have the patient sit down and put their arm up, and then we put on a tourniquet. What that does is it stops the flow of blood out of the arm towards the heart because we're drawing from a vein. And it causes the blood to pool up in the vein, which causes the vein to swell up so that we can feel it. Poke it. It feels like a rubber band.
Oh, it does. Oh, boing, boing.
And then after we feel the vein, we decide what kind of needle we're going to use. And then we clean the site. And on some types of blood, we have to clean even more because it has to be totally sterile. For this, it just has to be clean. And then we put the needle in.
This is a good time to ask about the blood color, huh? Can you zoom in on the blood?
And as you notice, when her blood comes out, even though there's no oxygen in this blood, it is still red. It is a much darker red, but it is still red.
So people sometimes call the blood blue there, Maddie?
Yeah. People think the blood's blue.
But it's not blue. Sometimes your veins do appear blue, but that's the type of cell that they're made out of and the way that they reflect light through your skin, it makes them look blue. But it doesn't have anything to do with the blood that's inside them. Just hold that for me. You want to put pressure on that? And so we have the patients put pressure on it because we did just poke a hole in their vein. And if they don't put pressure on it, blood will leak under the skin and cause a bruise. And nobody wants a bruise.
A Band-Aid.
So now we have blood here, and what we do is we take it in the back and we process it, and if you come on back, we'll show you some that's already processed so you can see the different parts of the blood. See, in this tube, you see at the bottom, there's a little gel separator. So we put it in this machine which spins it down and brings the red cells to the bottom and also the white blood cells, and it keeps just the liquid portion at the top because for these tests we only need the liquid portion. Now for this one you see there's no separator in it because for the test that's done on this one we need the blood all mixed like it is inside your body. So we don't separate it, we don't spin it down, we actually put it on a machine that keeps it rocking so that it stays all together.
Can you explain the different layers, like what each layer is?
Sure, like on the bottom, see we have, it's really dark red. These are the packed red cells. And towards the middle here, you can kind of see there's a white layer. We call that the buffy coat. That's actually your white blood cells. And then at the top we have the serum or plasma. In this tube, it's actually serum because the blood is already clotted. And like in this one, it would be plasma if we spun it down because the blood did not clot.
And then what are the different blood types?
The most common blood types in America are AB, A, B, and O, and those can all be Rh positive or negative. There are also much more rare blood types that you don't run into, but those are the most common.
And then what's the universal donor and universal?
The universal donor is O negative because there are no antigens on that blood that would cause a reaction in the patient, and the universal recipient is AB positive because they have all the antigens, so therefore they don't make any antibodies.
And then what tests can you run with your blood? Like what tests, I guess?
Lots of tests.
What are some common
normally,
ones?
like the ones we do here are some clinical chemistries, which is we test like how much glucose is in your blood, how much sodium is in your blood, how much potassium is in your blood, how much cholesterol is in your blood. We also, on like the tubes like this, we do what we call a complete blood count. We count how many red cells you have and how many white cells you have. We also count like which kinds of white cells you have. It can tell the doctor if you're having an infection, like what kind of infection you have, because some infections cause rises in certain types of white blood cells.
Why is there different colors on the tube?
Because these have chemicals in them. This one has potassium EDTA. It's a very gentle anticoagulant, so it doesn't mess up the cells, because in this test we're looking at not only how many reds and whites you have, but the shapes of them, so we want them to stay the shape that they are when they're inside your body. And this one is gold because the blood will clot in it. It doesn't have any anticoagulant. It actually has a substance that makes the blood clot faster, so that way we can tell the difference what's inside them just by the color of the top.
Okay, so with what tube of blood can I check my glucose in?
You can check it with, the one we do here is the gold top. In some labs they have a green top that has lithium heparin in it.
What analyzer?
And what analyzer?
This super awesome analyzer right here behind you runs all our clinical chemistries. And it does it by magic. No, I'm just kidding. It has different reagents inside it. We put them in this way. And then just like little needles. Hold on. Inside here is where we keep all the reagents that cause the chemical reactions, and then there's just little needles here that they go into the sample and pull them up and put them in there, and then a light reads the chemical reaction inside, and it tells us how much stuff it has in it. Super simple version.
So what do you do with the blood when you're done using it?
We store it here in the lab for 7 days, and then if after 7 days, if we don't need it anymore, it gets incinerated.
What does that mean?
It gets put into a machine that is really hot that destroys all the potentially dangerous stuff in your blood, because blood from person to person isn't necessarily safe because diseases are carried in your blood. And then also after everything's cooked, it chops it into tiny, tiny little bits so that it's safe and not sharp for your local body.
Alright, well I think we're done. Thank you very much for explaining this.
Ew. Oh no, we can't shake hands because I'm still wearing gloves and these are contaminated.
That was a test. You passed.
Alright, well thank you.
Alright, you guys have a great day.
Alright, thank you.
Awesome.
You're a really good actress.
We're done?
Yeah.
Can't shake hands.